of Cardiology as a first year resident in MCH CVTS program in the month of April this year. It has been 4 months since then and it has been a great journey so far. As first year residents, we get posted in the pre-operative wards, in the operation theatre, in the post-operative recovery rooms, in the post-operative wards as well as in the surgical ICUs. So that way we get to follow the patients throughout their course of management here and also learn each and every aspect of patient care. Besides that, in the operation theatre, we get the exposure to a broad spectrum of cases in the pediatric as well as in the adult section. For example, cases like ASDs, VSDs and the complex congenital heart diseases and the procedures like arterial switch operations in the pediatric section, and also cases like CABGs, valvular heart diseases and aortic root replacement surgeries and Bentall procedures in the adult section. So that way we get the exposure to a wide variety of cases both in adult as well as in the pediatric section. Besides the cardiac surgeries, there is also a good exposure of vascular cases as well as thoracic cases here. So this way this has been a great journey so far, and it has been a privilege to be a part of an institute that offers so much to learn.
Hi, I am Dr. Unmicrc, second year resident at Unmicrc Hospital. Amazing thing about Unmicrc is the exposure of the extensive practical as well as the theoretical knowledge. We get scrubbed in cases in adult cases from valves and CBG as well as to adult congenital cases as well as abdominal aortic aneurysms. In congenital we see from switch and ASD, the whole spectrum is being covered. The academic schedule over here is very nicely structured. Every month we get a schedule where each resident is assigned a topic and there is a moderator, a supervisor who would guide the resident regarding that topic and solve the queries, and the presenter will present the session in front of all the staff, the faculty members and the residents, and a good discussion is done. Recently we started with the interdepartmental sessions on cardiopulmonary bypass machine, where Department of Cardiac Anesthesia, the cardiac surgery as well as the perfusionists get together and we discuss about a topic extensively. We get inputs from all the departments and we have a very good discussion regarding the same. Recently we had a session on the anatomy of heart, where each structure of the heart was dissected and shown to us and very nicely taught about the anatomy. Every Saturday we have cath meet, where Department of the Cardiac Anesthesia, the surgeons and the cardiology get together and we discuss about complicated cases where we get inputs from all the departments and a final structured plan decided for the patients. So this covers the extensive academic, and with this way the complete course of cardiac surgery is step by step cleared throughout the 3 years.
aspirant who secured a good rank in the NEET super speciality competitive exam will definitely be in a doubt of choosing an institution which he has to pursue for next 3 years. So coming to this institution, there is a huge patient load. At any given point of time, there is 90 to 95% of occupancy rate. And coming to the exposure for the residents, and there are so many versatility of cases and lot of exposure in pediatric CVTs, adult CVTs, thoracic surgery, vascular surgery. And during my residency program, I used to get a stipend of 1 lakh per month, which is really sufficient. And the stipend increases every year. And in the end of third year, and by the starting of the third year, it will be around 1.13 lakh per month. And the administration also provides a hostel facility which is free of cost and which is really sufficient for a resident with single occupancy, with attached bathroom and also a wonderful view from the balcony. And the best thing of it is they also provide a mess which is dedicated for the residents and the staff doctors. And if you have a good rank in the NEET super speciality exam, so UN Mehta Institute of Cardiology and Research Center is definitely a good choice without any other thought. So